Good evening, viewers of ATV. My name is Maiga David Mark. I work with Star Medical Center located in Mbarara City, opposite Nyamichobola Police Station in Nyamichobola Cell. Today I picked up a topic. I'm going to present a topic about pelvic inflammatory disease. And today I chose to consider ladies. This is very common in ladies. So I'll give you an outline of what we are going to talk about today. We shall have the definition of a pelvic inflammatory disease. We shall have the causes on the agenda. Then the third theme will be the risk factors. Who is at the risk of getting the PIDs. Then the other thing will be the signs and symptoms. What should someone look at and say this is a PID? Then from the signs and symptoms, we shall have the investigations. Or how can we investigate? How can we go to the lab and say this person is having a PID? Then the other thing will be about the treatment options we have if we are going to deal with a PID. The other thing will be the management plan and the preventive measures. So allow me to start off with a show. PID is just an abbreviation, but it is pelvic inflammatory disease. This is an infection of the female reproductive system, basically the upper reproductive system, including the womb, where the baby grows, of course, the fallopian tubes, and then the ovaries. Next on the agenda, the causes of the pelvic inflammatory disease. The main cause of this disease is bacteria, basically. If someone has had an STI, secondary to a bacteria, that can be a chlamydial infection or a gonococcal infection. It can ascend to the upper reproductive system, affecting the womb, the fallopian tubes, and the ovaries. So basically, that is the cause. It is basically bacterial. And on the agenda, we have who is at a risk. Who is at a risk of getting this pelvic inflammatory disease? These are the risk factors. You find if someone has more than one sexual partners, this includes the prostitutes, not even the prostitutes, but as you have more than one sexual partners, you are at a risk of getting a PID. Then the other thing is someone who has treated a PID before is also at a risk of getting a PID. Then the other thing is when someone is mistreating an STI, if you miss or if you delay treatment for an STI, it can still ascend and turn into a PID. There are very many risk factors. Of course, if someone has early sex, say if you spark off sex at an age of 15, still you are at a risk of getting a PID. Then the other thing is I talked of multiple sex partners. Any female lady, any female who is under the age of 25 is also at a risk of getting a PID. So basically, those are what we have. Anyone who is under the age of 25, if you start sex at an early age, if you have more than one sex partners, that is multiple sex partners. If you have of recent treated an STI and it is not curing well, it can progress into a PID. And someone who has had a risk of, who was recently treated for a PID is still at a risk of getting a PID. Then next on the agenda, we have signs and symptoms. Signs and symptoms. When should someone say, I have this and this, so I might be having a pelvic inflammatory disease? So basically, when we look at the signs, most ladies who have come to the clinic, they usually report pain in the lower tummy, that is pain below the umbilicus. They usually report that pain, and you find in most cases it is longer than 2 weeks in most cases. Then they have pain during their menses. If they are during their menses, they have pain. Then irregular bleeding besides menstruation. You can have many times in a month bleeding. And then the other thing is unusual vaginal discharge. It can be smelly. It can have a change in color, especially yellow, greenish color. The smell can be fishy, like fish. Then the other thing is long periods. Long and heavy periods can also be a sign of a PID. Then the other thing, we can have backache, the lower backache. Someone who has had a pelvic inflammatory disease can have backache. The other thing is painful intercourse. In science, we call it dyspareunia. While having sex with your man, you can feel pain. Where does this originate from? So when the cervix is infected, it is swelling. In that case, it becomes tender. So every time you have sex with a man, the man points points on the cervix, and you feel pain. That is what we call pain during an intercourse. I think that's what I can say about the signs. Of course, if it is severe, people will come when they are generally weak. They have the fever and all that stuff. The other thing on the agenda, when should someone seek for medical attention? When to see a doctor, in brief. Of course, if you have any of the signs I've just said above, you are eligible to go and see a doctor or your health work practitioner, and you have some checkups and treatment as well. So the other thing I need to talk about a PID is treatment options. Basically, a PID is curable. That is, if it is diagnosed early and the patient is compliant to drugs, it can be cured fully, and the person gets fully fine. So the treatment options, of course, we have antibiotics. You will find in most cases, ladies who have had episodes of PIDs, they are usually given antibiotics for some time, at least 2 weeks, because this is a very hard thing to deal with. That is why we usually prolong the treatment for 2 weeks. Then we have conservative measures for someone to get away with the PIDs. We expect that person to stick on one partner, of course, avoid multiple sex partners, good hygiene. You see, these ladies, in most cases, many ladies do not know how to dodge. When you're dodging, you're not supposed to use any kind of detergent. It should be plain water alone. You use plain water. You can even have boiled and cold plain water. Don't add in soap, don't add in a detergent, don't put in gin, nothing of that sort. Then the other thing, when we are cleaning ourselves, let's say after a long call, you should use a tissue, and you should be cleaning from front to backwards. Because usually you find when you clean from backwards to front, feces contain a very fatal bacteria called E. coli, and once it gets attached to the female reproductive system, you might have a very hard time treating it, and you find people develop so many complications. Then the other thing, what we need to look at is complications, the complications of a pelvic inflammatory disease. So you find in most cases, complication is what results from having that disease. You find in most cases, ladies who have treated PIDs repeatedly, you find they report chronic pelvic pain. That is, chronic pelvic pain is pain that stands for so long. That is, chronic pelvic pain includes backache, and then these bones in the pelvic region, the hip bone, in the pelvic region. Then you find there is also a complication of ectopic pregnancy. Ectopic pregnancy briefly means a pregnancy that takes place elsewhere apart from the uterus, the womb of the baby. It can take place commonly in the fallopian tubes. So if someone treats a PID, or if someone has had recurrent episodes of a PID, you find we have scarring in the tubes, scarring in the fallopian tubes, and once they scar, they decrease in size. So in the time of ovulation, you find the egg lodges, gets stuck in the fallopian tubes, and therefore cannot be transferred to the womb where the baby is supposed to grow from. So in that case, when the egg lodges in the fallopian tubes, you find the baby grows from there, and this woman will come after like 1 month of pregnancy. They report pain sided in the lower abdomen. On doing these investigations like ultrasound scan, you find a baby is growing in the tubes. That is ectopic pregnancy. Then the other complication is abscesses. An abscess is a collection of a fluid. So for someone who has recurrently been treating the PIDs, you find they form those abscesses, and they actually, one of the management plans for abscesses, you find you undergo surgeries to drain those abscesses, something that is really very fatal to life. So then the other thing is infertility. This is usually secondary infertility for someone who has given birth before. And you find for someone who starts treating pelvic inflammatory disease at an early age before birth, you find if someone recurrently gets those infections, they get a complication of infertility. When the tubes actually get stuck, they block, and therefore cannot allow the egg to pass through into the womb. Then on the agenda, we have, lastly, we have the preventive measures. One of the preventive measures of a PID, it is basically proper hygiene, like I talked about it. Proper hygiene, someone is supposed to clean those private parts properly. And then the other thing is avoid multiple sex partners. There is early diagnosis of an STI and prompt treatment. And then there is, in case you experience any of the signs above, you should seek for medical advice. Avoid self-medication, because we usually find resistance to drugs in many clients after trying self-medication for so long. Then the other thing, you avoid playing unprotected sex in case you have a new partner. So basically about the pelvic inflammatory disease, we really need to extend healthy education to the ladies basically, and tell them what it really is in the normal life. You find we have had clients who have abnormal discharge, and you find they take it normal, but going deep into a conversation and explain to them, they find they have problems. Many ladies out there are seated having problems, but in the long run, they are not sure if they are real problems. And you find these ladies, they are always stigmatized, they really fear to speak up. So it is better we usually engage them in all ways possible to find out what they are facing, especially this private life of theirs. So health education will basically be about hygiene, how they are supposed to clean themselves. You teach them what is normal, what is the normal discharge. You teach them what is the normal mensing is. Basically, these ladies, you find a lady is having painful menstruation. You find the lady is having abnormal vaginal discharge, but in themselves do not know that if it is abnormal or normal. So you find in most cases these PIDs originate from sexually transmitted diseases that if they are not treated in time, or if they are not treated properly, they are sent to the upper reproductive system. So basically on the health education, if they can isolate that they have a problem, they should seek medical advice early in time, such they are treated promptly and avoid the progression to PIDs. So next, You find many ladies out there having this and the other partners, but without knowing it, they are at a risk. So in most cases, someone who has had multiple sex partners is at a great risk. And you find sometimes if the upper reproductive system is totally destroyed, you can have abscesses in the upper reproductive system, and you end up even doing invasive procedures like hysterectomy, where you find the entire reproductive system is removed. That is totally permanent infertility. You cannot reverse it. So my ladies out there, we should actually teach our young ladies, the daughters. You need to teach them, you need to take them for outreaches in case we stage many of them. You should take them to the medical facilities for health education. We have enrolled midwives around, but everywhere they can teach them how to clean themselves, how to isolate the normal from the abnormal. So in most cases, these things actually, you find in most cases these pelvic inflammatory diseases and STIs, the better method to handle them is not giving drugs. But sometimes, personally, I think if we teach them how to prevent and how to isolate the normal from the abnormal, such that if they come in the facilities at an early stage, we usually don't get hard time treating them. But many ladies out there stay at home, feeling mildly pain, bearable pain, and they end up coming to the facility when they are worse, when they are beyond repair. So many of the signs, they may seem not so much painful. That's why many of ladies stay at home. But personally, I would recommend anyone who sees something that they have not had before, they should report to the health facilities. So with PIDs, like I talked about PIDs, they are complications of STIs. And you see, usually these age from 15 to 35, we are sexually active. You find someone is having like 10 sexual partners, people infected with various bacteria, various viruses, HPV. You find actually someone who has treated, been getting PIDs all the time. You find you reach an extent when your libido for sex, because the brain reads, and you find your libido for sex reduces because you feel every time you're going to have sex, you feel pain. Every time you're going to have sex, you have a discharge, a smelly, fishy smell, you have an abnormal discharge that is not really present. You find even the partner loses interest in you, and yourself, to that pain that you feel, you find you do not have the urge to play sex. And basically, what do we need to focus on? I think we need to focus on the complications and preventive measures. Many of these complications are really hard to reverse. For example, I'll tell you about infertility. If someone fails to conceive after treating previous episodes of PIDs, pelvic inflammatory disease, you find they really have a hard time to conceive again. This is something that is going to cause misery in the family. It is going to cause blockages of families. It is not basically having issues to do with health, but you find this thing will continue up to the normal life we live in. You're not going to have a happy family if you're in a family and you're not giving birth, because ladies are supposed to give birth. So if you marry a man and you have treated recurrent episodes of PID and you cannot conceive, I don't think you'll have a happy life. Then the other thing is long pelvic pain. Some people are bedridden. You find they actually restricted from doing some activities because of the long chronic pelvic pain. Then you find if someone has an ectopic pregnancy that is secondary to the PIDs, previous treatments of PIDs or previous occurrences of PIDs. So ectopic pregnancy is really hard. You cannot grow an ectopic pregnancy in most cases. So there you'll need to go for surgical management, where they will have to cut and remove the baby from the tubes, and you find those tubes are going to scar. You find many ladies, they have pain after the procedures, but tubes are blocked, so you find they are unable to give birth again. So my ladies out there, just in case you happen to get any of the signs I listed above, you really need to go and seek medical attention. The pain during menses, bleeding that is not of mensing, the pain during sex, and unusual discharge from the vagina. It can be smelly, it can have a bad appearance from the normal. Then the other thing is heavy mensing. You find someone has recently been changing like 3 pads a day, but due to a PID, you find someone is having like 7 pads in a day. So that heavy mensing will generally make you weak. You feel feverish because of a PID. Then the other thing is about the definitive management. You find we put clients on treatment. You know, it's really very hard to comply on treatment, and usually the treatment for PIDs takes some long time, like 14 days, and you find many people are not present with taking tablets. So my ladies out there, I urge you to adhere to treatment if you really want to come out with good results after treating a pelvic inflammatory disease. Then the other thing, I think on the complications, I talked about abscesses. See many ladies out there, they come with pain, and once you go deep in discussion with them, you find many have treated pelvic inflammatory disease, and once you happen to do investigations like a scan, you find they have abscesses which require for surgical management and really have fatal complications, can have fatal complications. Then the other thing about pelvic inflammatory disease we need to stick on is who is at a risk, who is eligible to get a pelvic inflammatory disease, who is at a risk of getting pelvic inflammatory disease. For anyone who has been recurrently treating sexually transmitted infections like gonorrhea, chlamydia infections, candidiasis, those people are at a risk of getting pelvic inflammatory diseases. Like I told you, PID, pelvic inflammatory disease, is a complication of sexually transmitted disease. So when they ascend from the lower reproductive system, that is from the vagina and the cervix, they cross to the upper part of the reproductive system, you end up getting a pelvic inflammatory disease. For someone who has had a history of an STI, is at a risk of getting a PID. Then the other thing, for someone who has had sex at an early stage, that is between 15 and 25, you're also at a risk of getting a PID. Then for someone who has had invasive procedures like insertion of an IUD, you can damage the cervix and eventually get a PID. Then another procedure is abortion. For someone who has attempted to get rid of a pregnancy before it is at term, you can still damage the cervix and end up getting a pelvic inflammatory disease. Then, like I've always sung about this, multiple sex partners. You see, everyone has their way of life. It's not really good to have many sex partners because everyone comes with their own infections and you end up getting a pelvic inflammatory disease. Then the other thing is invasive procedures during childbirth. You can still get damage to any of those parts, the cervix, the womb, the tubes and the ovary during childbirth, and you end up getting a pelvic inflammatory disease. So I think of course, I didn't talk about I've not talked about when we talk of the pelvic inflammatory disease, which areas get affected. We have the cervix, that is like the gate of the upper reproductive system. We have the womb and the womb lining, that is where the baby grows. We have the fallopian tubes, they are called enseche. Then we have the ovaries. Those are the areas that are affected during an infection of a PID. Thank you so much, viewers of 8 TV. I remain my guy David Mark, working with Star Medical Center located in Ichizung, opposite Nyamichobola Police Station in Nyamichobola Cell. Bye.
You're watching a